Hi, in this video I'm going to explain what we do different and what you are going to do different when you follow Stroke.Fitness training. Now, before I explain the three-layered approach that makes up the core of what we do with training, I'm going to explain a very important principle. After a stroke, say we have two parts of the brain. And these are the two hemispheres. Here we have the two cerebelli, brainstem, spinal cord. And say the right arm and the right leg are affected. Yeah? So we have a stroke, for example, here in mid-cerebral artery territory. Then we know that the pathways here don't function very well. Now, the misconception is when you work on the arm and the leg, and maybe you work on speech, then you would think you are training these parts. Well, in fact, literature shows that you're actually enhancing the good hemisphere or the good cerebellum, and we create more imbalance between the two parts of the brain, because these parts, when they get overactive, they inhibit, they get stronger, and they press these already malfunctioning parts a little bit further away. Keep them alive, but press them away. So you can never, here is the fine-tuning, for example, of hand, foot control, speech. This can never do that. But if you train the affected side, you will actually do enhance the already good part. So this is a very good, important concept. So I'm going to explain how we can create crosstalk so we are really engaging the affected parts. Even if you can never fully recover them, you can still do things to increase. If this is the back of the brain, this is the front, you can do, say, this part here is affected. We can still do things here and here, or very close to the affected parts, to have a powerful effect to the other side. So, how are we doing that? And this will get you very excited. So, if we want a optimal functioning brain, we need to think developmental. So, we need to think, I always like to make a pyramid, and then you understand. So, we have a foundation. We have integration of balance and sensory information, and I'm try to make it simple now. And we have a layer where we really sync brain function within the brain, and also to get top-down approach. So if this is layer 1, this is layer 2, this is layer 3. Then we have a bottom-up approach, and we have a top-down approach. So bottom-up first, remember the first layer. Second layer, integration. This is really the cornerstone. Going to explain a little bit more about that later. And the foundation is comprised of core stability, basic movements, basic movement patterns like what you have when you are a child and you lay on your back and start moving in random patterns, and when there's like the nerve system is built, you get more control, you get more precision, you can learn very complex movement patterns, but only when the brain here develops further. So in the core also is stress management. It's very important. That's the balance within the autonomic nervous system. We don't want to have too much sympathetic drive, yet the reality is a lot of us have too much sympathetic stress, fight, flight drive and too little rest drive, which has a huge effect on if you can go through these layers. So we have breathing, very important, say O2. Breathing, one of the most difficult exercises, believe it or not, is having proper breathing, where you really expand the breathing down into your chest. And that is like one of the tricks you can use if an exercise doesn't work out. You can use breathing to make it work. So that's why we place a lot of emphasis on breathing. On posture. Posture has a huge effect on how well you can integrate brain activity. If you have too much forward posturing, you will never be able to use and engage all the brain networks in an optimal way. So posture, breathing, basic movement patterns, reflexes that you are born with, we want to get rid of them. They often reappear after a stroke. It's all down in the foundation layer. We use a lot of shoulder, hip, quadrupedal movement, natural movement progressions, natural movements to go through the next layer where we integrate balance and sensory integration, eyesight, hearing, feeling, touch, awareness of your body. This is hugely important. And layer 2, when we arrive there, sometimes we use overlaps, this is where we have to make sure that the information from your body that you use, if this is the brain from the side, this is the frontal lobe, this is the primary drive from the motor cortex, this is where all the sensory information comes in, the sensory parietal cortex, that feeds into the primary motor strip, just like we have the supplementary motor areas, and the premotor areas feed into the primary motor strip as well. We have to have the right feedback from your body, so we can emphasize that. More importantly, we have to know where our body is in space. The reality is, when you have a stroke, your perception of where you are in space, if this is the middle point in between your legs, normally, say these are your legs, then this is where the center of pressure normally is. We see that it shifts backwards, forwards. For example, when the brainstem or cerebellum are affected, usually backwards, and we shift towards the limits of stability. This is where you get scared when you move into a site that you will fall and you have to correct yourself, and often you can't because you had a stroke, you move slower. So shifting this backwards, which is often completely opposites of how you think you have trained, we have to train into this direction, will actually make sure that you're more aware where your body is in space, and we relearn anything we do with the arm, hand and legs, we will learn in the proper position, not here. You don't want to learn here, here or here, because that is learning movements in a completely different awareness of where your body is in space. So, and then the last layer that we address is really the integration of networks both between the two hemispheres. And if we do like a lot of these foundational movements, and we use that throughout the layer 1, 2 and 3, we do a lot of whole body movements to let the right and the left brain communicate again. So we have inhibition, disinhibition, and if we cross the midline and we move on both sides, we make sure that we engage this hemisphere again. And that we combine with communication within the brain. Like I said, we have the areas in front and in the back that feed into, for example, the motor areas. We have to make sure that this starts communicating better again, and those we can do with specific cognitive tasking. So we see that not only within the brain we get a balance that is correct, but we also make sure that all the parts within the brain, as far as possible, start to integrate again and not just compensate, because this is often what happens. You start using, and this is why I started with this, you start using the good parts of the brain, the good hemisphere. Within the brain we start to put emphasis, for example, here or completely in front, meaning that you spend a lot of energy. It's less efficient than when we start communicating here better. And those are the 3 layers that we're going to work with. This takes 12 to 24 months. We're going to make sure that you go through all the layers and make all the steps within the layers, and then you will see that things start moving again. You cannot train in the same way as you have done to this point and think that you will get better results. Even training harder will not make sure that you get those results. And with this 3-layered approach, together with the machines that we have developed to get the right movements, the right whole body moves, get the right neuroplasticity through repetition, we can make sure that you can make these next steps again.